I'm Michelle Strange, your host, and I'm passionate about equipping dental teams with the tools and knowledge to excel in patient safety and infection prevention. Today, we're going to be focusing on autoclaves. I told you this would be a very nuanced season around infection prevention. And today, I'm joined with Karen Gregory, who has incredible expertise in this area. Actually, Karen and I just came back from Italy, where we got even more training on autoclaves and sterilization and the whole sterilization process. And so I'm so happy to have you on, Karen. Welcome.
I am so excited to be here. This is only my first or second podcast, so I'm super excited about this, and I love sterilizer. So, a great topic for me to talk about with you.
I don't even know how that's possible that you haven't done more episodes. Well, thank you for coming on and joining us. So, this whole season is about the nuances of infection prevention and autoclaves. When we were in Italy, I think you and I learned even more about the nuances of sterilization
Yes.
and autoclaves and sterile storage and the cleaning process. And so I want to dive into it. Where would you like to start? Since I'm going to let you lead us today.
Oh, okay. I've been thinking about this a lot. And over the past couple of years, I have worked with some practices that have had some challenges around instrument reprocessing. And actually, and you may be surprised to hear this, I actually think it starts in purchasing or procurement. And one of the things that I see is that people will buy an instrument and they actually don't have the right type of equipment to either clean it or sterilize it. Or they might have a sterilizer that doesn't have the cycles pre-programmed that handpiece is calling for. So one of the things and I used to say this oftentimes in presentations, but once I started working with these clinics, the reality of really knowing about the equipment before you're purchasing it is critically important. And of course, that involves looking at manufacturer's instructions for use, which I find that a lot of people are not even aware of those in the world of dentistry. And so there's a lot of stuff behind the scenes that impact that instrument being sterile and ready to be used chairside. And oftentimes we hop right to that process of, oh, transport, clean, dry, all of that. But do you really even understand what the manufacturer is saying about how to use that equipment and how to take care of it and make it safe for use on another patient? So I think,
Go ahead. No, finish.
yeah, no, I think this reality it really hit home when we were in Italy and just looking at those processes and breaking it down. It was, oh my, it really begins with purchasing.
That is actually so accurate in so many areas, I think, of infection control because we even think about it with disinfection, right? Are we buying products and then confirming that our disinfectants that we use can be used on all of those products, or is there a majority of those that we can use? And so I
Right.
think you're so spot on about I'm a hygienist. I always joke that I'd show up and there was some new piece of equipment and I'm like, what is this? Where does this come from? And the dentist was like, we're using this now. I'm like, hold up, wait a second.
Yeah.
And then
No.
like we'd all get excited about it. And then it was like went and just sat in the corner and getting dust. Or we had some new process, some protocol, and we all hated it. So we always tried not to use it.
It's shortchanging whatever we can do to make the workflow as easy as possible because let's face it, people are busy. It's not like you have a lot of additional built-in downtime to focus on cleaning, disinfection, to focus on instrument reprocessing because for the majority of practices I work with or have worked with over the past probably 15 years, they don't have an assigned person in that sterilization area. It's whoever has time. And they go, oh, this is automated. All I have to do is press a button on that sterilizer based on the type of packaging, not realizing that, oh my, those instructions for use may say a different or outline a different temperature level or a different time. And that's not being connected in the outpatient environment, in my opinion. This is what I see. I push a button, I'm done. That's not entirely true. Sometimes that method works, but especially around hand pieces, I've found a lot of hand pieces are the manufacturer's instructions for use will say a 273-degree cycle for 3 minutes. And across a continuum, and if there is a unit out there that you're aware of, those pre-programmed cycles are a 270 for 4 minutes. And in the United States, you don't have a 273 for 3 minute program cycle. And technically, those hand pieces are not sterile if you are not sterilizing them the way that manufacturer's instructions for use has outlined for you. And there is a disconnect, I think, with people that are loading and unloading that sterilizer that this is bigger than pressing a button.
Or 273 at 5 minutes, which is what I found on one of my IFUs, like I said, remember that? And I was like, "Why are we going higher for longer? That doesn't make sense."
Actually, there is a handpiece that is a 273 for 10 minutes.
Which
And I'm
I
like,
think is that not melting things?
remember you and I talked about that, and I actually confirmed with the manufacturer, and it's because of the components. And I've asked a couple of different hygienists because it's a hygiene handpiece, and they all the response was, "Oh no, I didn't realize that." So
We don't realize that, and it is I think and one of the things that I think you and I just kept being like, "Oh my gosh, no one knows this, nobody knows this," is the very specific details of the cleaning process, the inspection process. Bagging, I feel like we do put a lot of emphasis on, but we could train people to not over bag, like all those things. We can work through those,
right.
I think, for the most part. But it's like that cleaning step and the drying step
The dry
and the packaging, but then the sterile store or what happens on the after the sterilization, that 274 minutes happens, like, what goes on there? And as a hygienist that I love infection control, and I have worked in offices that were surgical, and we were all very specific about things, still didn't know a lot of these details.
Right. Well, I think once the sterilization cycle is done and it pops up done, people go, "Oh, I can grab those instruments and use them." And in some situations that I've actually worked in, those instruments are still wet, but the door is open and I can grab it and people are asking for it. And this reality that if instruments are wet and they're exposed to air or they're handled, then they're considered contaminated and they actually should go back to the beginning and start the process or at least be repackaged and re-sterilized. And that has become an acceptable process. I have witnessed that in so many different practices that I have been in. I will go in and the instruments will be lying on a towel or on the counter, and part of the packaging is wet. And either they didn't allow the drying cycle to complete, they grabbed it before the drying cycle was complete, or they overloaded the unit, or the instruments were wet when they went in for that sterilization cycle. But the acceptance of the fact that it is okay to grab those wet packages and handle them and use them is something, and I've said this before, I'm on a mission to educate people. That's not safe. That is not the way that instrument reprocessing should go. I don't know if you know this, but one of my first jobs as a nurse was an operating room nurse. And yeah, and so I think about the processes that we would take and break down the room, and the instruments would go in this metal cart, and I would call it the belly of the well, go down, and then we would get instruments back. But I was assured that those instruments were sterile no matter what process we were doing. It could be a colonoscopy or it could be a repair of an abdominal aortic aneurysm. But those instruments were ready and they were sterile for use. And I feel like if I'm going to be receiving oral health care, I want to know that those instruments are sterile. I know it's going into the mouth, and a lot of people say, "You eat at restaurants, that's different." We were going in and by the way, restaurants have certain hygiene measures that they have to meet, and they actually get a grade on it. And
On their door, so you know before you walk
exactly,
in.
exactly, and
Imagine if dentistry did that.
yeah. So we had people that were trained. It was their job day in and day out to make sure that those instruments went through the appropriate cleaning and inspection process and packaging. And I, eh, they had to have a lot of training. And I feel like, unfortunately, sometimes in dentistry, it's a see one, do one. I've actually fielded phone calls where a dentist wanted to hire his neighbor's son that was on summer break before college to work in instrument reprocessing. And that's very kind to want to offer them a job, but this is the center of your practice. It could make or break you, literally. Outcome with the case.
It's so true.
Yeah.
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 Two things that popped in my head is that,
Okay.
one, we don't think of dentistry as surgical often.
Okay.
And I feel like we normalize we're doing a filling over here, we're doing a crown over here, we're doing a surgical extraction, and we're bopping from each one of these rooms, which is next
Right.
to my hygiene clinic. We don't see these as tiny surgical operatories.
Ah, and I do.
Right? Right. You should. You should.
And, I think that I had a discussion with a dentist, and he was more leaning toward, oh, let's just consider that. Does it really matter if those instruments are sterile at the point of use? Because once you open them to air, they're contaminated. And I said, there's some truth to that. Even in an OR environment, once you open them, they are exposed to the air, but you've got to have a baseline. There has to be a baseline, and sterility cannot be different in the OR as compared to a dental practice. Either it's sterile or it's not, and there's certain key elements that need to be in place in order for that to occur. And understanding that whole sterilization cycle, starting with procurement, but then cleaning and drying, inspecting, packaging correctly so that you don't overload a package so that the steam can't penetrate all and touch all the surfaces, making sure that the instruments are dry and cool before you handle them, and then storing them appropriately. The more you handle that package, the higher the risk is that the packaging is going to be compromised and then should not be used on a patient. So I think it's much more of a detailed process than most line workers have the time
Mm.
to focus on. I think the challenge is time and education.
Yeah. There's very much this hustle culture. I talk about it a lot in social media, especially when I get responses of, I need that instrument, or I like, nobody's got time for that. And it was like, how are you telling your patients this? How are
They don't
you
know.
explaining to them? And I always say, I need you to explain it to me like you would to a patient's face
Yes.
like, how would you not be open with them about this? And of course they're not. And if not, then we need to talk about integrity because we lack it in that moment then. But for that doctor, I know that probably happens a lot. I just don't know how we don't scream to them being like, does it matter that it's sterile when it comes to point of use when you like, yes, yes,
Yes.
yes. It
It put me off guard, and people were watching what was going on, and finally, I looked at him and I said, I think it's apparent that I'm not going to sway your opinion, but I would tell you I would want those instruments sterile if I was sitting in your chair, and they're I think you owe that to people.
they put their trust in you, like,
Yes.
that just seems horrible, but my thought is, okay, 1, we're saying it's sterile in this package, so it went through the proper cleaning, drying, sterilization, drying again stage, so
Right.
from the last person that it was used on that I am not getting any kind of bloodborne pathogen. I take it even down to norovirus or the flu. Like, I don't
Right.
want anything staph or what so
Herpes.
many things. Herpes, yes, I don't want any.
Yes.
So, yes, it is actually sterile, that does matter. But then also we'll talk about this in this season, which is air quality, that when we open it, we don't have God knows what floating around our office. So, technically, when you open it, it's not sterile, but it is as sterile as it possibly could be, is as clean as it will possibly be. We are not trying to transmit disease. And that has to be explained to people. I'm just like, we have missed the plot. I fear
Yeah.
we have lost the plot here.
And I think there's something to that. I and this is how I feel. I I I I feel like, and this is based on talking to several dentists who, in the past 10 years, have graduated from dental school, and they have all said we did not get adequate education around this. And so, if it's not ingrained in you from the beginning, the importance of that, then how does that translate into your day in and day out practice? I don't know. This is what these young dentists have said to me. And that's puzzling to me, honestly. But they're there. The dentists are there to actually fix the teeth, do those kinds of things, and that's where their skill level is. Understanding what it takes to get there, I think would be a good course, and
Yeah.
helping them understand that in a dental practice, the buck is gonna stop with you, and so understanding what needs to occur and putting people in place that know the process and then can spit that back out at you and that can push back on you and say, "This is not safe," and you be willing, to hear that. So it is a little bit of a challenge, but I do think that there is a grassroots need to better educate dental assistants, hygienists on what does it take for an instrument to be dirty chairside to get it to sterile chairside again, and, it does take a time commitment, and I just find that is not woven into most schedules. I don't know, maybe do you see that when you're out?
No, I've actually had to argue with some consultants that were like, in a hygiene hour, you have this amount for medical history, this amount for cleaning, this much for exam, whatever. And then the sterilization infection control was 3 minutes.
Yeah, no,
I was like, my disinfecting is 3 minute kill time. Like, how am I supposed to do any of this in 3 minutes?
that
And I really feel like it was so very reductive to what has to happen in that hour, that if you're lucky enough to get an hour as a dental hygienist, it is, yes, from starting the patient, but it's the turnover, it's the sterilization for a lot of practices because we are smaller. Some might have, and I have worked in those practices where we've had a sterilization tech or whatever. Yeah, no, it's not considered. And one thing that I would love to focus on too with us today is I would love to talk about the importance of the drying and then the cycles, but then the drying cycle and the sterile storage. And I would like to have this conversation with the idea that we already are going to understand that clean has to happen.
yes.
Clean has to happen. Inspection has to happen. We're going to go into this conversation with that just being like
Yeah,
the understood process, which is something that is very also nuanced that we could talk about later. But
right.
let's consider everything cleaned. We've gone through all those processes. One thing that I thought was so fascinating was how much emphasis in Italy and other European countries they put on the dry step.
Yes, and that was something that I think they helped us to understand that pooled water on instruments actually is considered almost as if they're still dirty because the water protects the instrumentation underneath and creates this cold spot, for lack of a better description, so that it is not technically, it can't be sterilized appropriately. Also, they talked about, which I thought was very interesting, is that the units are set to pull out X amount of moisture after that sterilization cycle is complete. So water goes in, the steam is created, and steam and pressure instrument sterilized, and then it becomes condensate. If you've got instruments, every one of them that are wet, that sterilizer is not set to pull that additional water out, which creates another probable cause, I guess, for wet packaging at the end of the sterilization cycle. So that is, I think, a hurdle for people because you said it a little bit earlier. I need that instrument.
Mhm.
Maybe you don't have enough of that instrument. Maybe there's not enough bottom line numbers to really support a process that allows the drying to occur. Or perhaps you don't have enough sterilizers. So you get backlogged, and I've got to have it. So we have that challenge. So dry, appropriately packaged, and then loading appropriately. I thought it was so interesting. And they discussed with us the fact that you want heavier items on the bottom and bigger items on the bottom because they're going to drip more after
Yeah.
there that decompression stage, for lack of a better word. But then that moisture is going to drop down on those smaller packages and make it harder for the unit to dry. So much about it's almost a math equation. You remember when we walked past that room and there was a whole board? It was a math equation. You remember that?
Yes, with the neatest handwriting I think I've ever
I
seen.
know. Wasn't that crazy? But these are the people that use their math skills, unlike me.
They are the algorithm. Like, they are figuring it out. It was wild to see the formulas and stuff on.
Yeah, that drying piece can have an impact on whether or not that package is wet when it comes
Mm.
out. And then moving on to the actual drying process. I was very interested in the fact that when you have a unit that's a closed door drying, they actually, and correct me if I'm wrong, this is Karen's dummy version, that they use the change in the pressure in the unit to actually assist with the drying. And so if you've got a door that's open, you don't have, during the drying phase, you don't have that additional mechanism to help get those packages bone dry at the end of the cycle. Plus, and this has been what I've seen multiple times, if that door is popped open and they need that instrument,
They grabbing it.
get the hot pad. They're going to get the hot pad and they're going to.
If then, the amount of times, and I will say, I always say this in my courses, I have never been the pillar of perfection. I was on the job trained at 17. The habits that I started back then, definitely not the best. I have literally grabbed it by the little tiny corner and pulled it out and ran to the operatory with
Right.
it. Not even a hot glove.
Oh, yeah, and I do see that. Or, okay, we only have 3 minutes left on the drying cycle. Oh, they're almost dry. I'm gonna pull them out so that I can reload it. And I think this has been such a standard that we really need to educate that dry packages at the end of the sterilization and drying cycle is what is right, what is acceptable, and normalizing. And I've said this before, we have to normalize that packages should be dry at the end of the sterilization and drying cycle. And if that is not your norm, then what is your driver? What is the root cause of why that package is wet? Is it because it wasn't dry going in? Is it because you didn't load it appropriately? Or is it because you grabbed it before the drying cycle was complete and I we never saw a wet package in the OR. When I came into dentistry and started looking at things, I would go, why are they doing that? It was very foreign to me. Another example is the surgical wrap. Everybody always just uses one piece of surgical wrap. And I thought, I never had a package that was not double wrapped. And so that goes back to the IFU. What does the instructions for use say on that wrap? How are you supposed to use it? And I think it's almost like adults and looking at directions on how to put the bike together.
I'll cross figure it out.
I think I got it. I got it. I mean, my daughter just this week got a treadmill for her dog. You'll love it. I'll have to send you a picture. Yes.
Yes, please.
And and she pulled it and she said, "Oh, I can figure this out. I don't need to look at the directions." And I thought, "Oh my gosh, this is what I live with."
Yes.
In my work world, we feel like we can get it, but they are so critical. And I think we're missing a lot. when this is not part of the education process. This is not a norm when you go into a practice. Let me pull that instructions for use on that curing light tip. Does it need to
Mhm.
be heat sterilized? Or that handpiece? Okay, it needs to be sterilized, but at what temperature and for how long? And is that a pre-programmed cycle? And people are not used to not thinking outside of this is the kind of packaging I'm using, and I'm going to press that button. We've that has been the way
Unwrapped the end.
exactly. And by the way, you shouldn't be running anything unwrapped any longer unless it's a true emergency.
Which I think, unfortunately, we do see still in the industry. We see a lot of these rapid use sterilizers, or they just like throw them in there and then they'll go take them and put them in a drawer. And people are like, it was sterilized. Like, well, it's not sterile. It was sterilized, but it's not sterile.
Right, at the point of use. So it's that it should be sterile at the point of use, and you should be opening those instruments, the sterile instrument, when the patient is in the chair, not 3 days before or 2 days before on Friday afternoon for a Monday morning 6:30 appointment for a root canal.
Over the weekend. I've seen that. Like, we have a big implant surgery first thing Monday morning. So Thursday afternoon, we're opening this up. But we covered it.
Yeah, no, but
Cover bugs.
yeah, bugs walk around, and is anybody in there over the weekend? You just never know, and people are curious beings. "Ooh, what's under there?"
Yes. Yes, we are.
Right.
Yes, we are.
So I don't know. I think that here's what I would say. I think people are doing what they think is right. I don't think anybody intentionally is not is trying not to have sterile instruments for patients. I really think it is a level of they don't know the details. And there is this mindset of really it's not that big of a deal. And maybe there aren't documented cases of post-procedure infections. But
Does it
I'll
mean
just
they're
go
not
ahead and
there?
say that there's no in dentistry, there's really no requirement to report up. There is on the medical side of the business. So maybe there are, and we just don't know it. It hasn't been linked to a procedure related to oral health care delivery. But I just because there hasn't or we don't really know about it doesn't mean that we shouldn't strive for the absolute best. That's where I sit. So,
I think that's a great place to sit.
yeah.
I think people, humans would appreciate it.
Yeah, I hope a lot of people will join me.
I agree. I hope so too. And I think, like you said, a lot of them really don't understand. And I do think that when at the end of the day, we're humans, right? We all struggle with logical fallacies. We all struggle with cognitive biases and dissonance, and really making sure that we are checking ourselves. And are we allowing like a belief bias getting in our way? Are we, that anchoring by our fallacy, I think it's called, where you like learn that one piece of that information and that's the information you go off of. You have anchored yourself to that piece of information. And the reality is, even though it doesn't feel like infection control in the dental setting has evolved, it just might be a little bit slower. We absolutely know what we need to be doing. And it is important for us to, one, find out the information, learn the correct thing, but also to pivot and evolve with the science and our knowledge. And
Exactly.
said it perfectly. Like, just because there hasn't been a documented case, which there has in sterilization, like we had the New Jersey dentist that had 13 people go to the hospital for bacterial endocarditis and one died. So we have that evidence that if
Right.
you are not properly sterilizing your instruments, it can kill people. And the bar should not be, but did they die?
No, absolutely. And I mean, there's the case where hepatitis C was transferred to a patient. So there are cases out there, but it is a shame that there has to be a case to drive action. Instead, let's just do what is the absolute best that we can do for our patient. That legacy training, I think, too, is something. And I think that's what you were referring to. Sally taught me how to do this. But what is Sally basing that on? I always push back on people and say, why are you doing that? And I think it's really important to link that to either a best practice, a regulation, And when we talk about best practices, when we talk about sterilization, the really best go to, I think, for dentistry is the CDC, the Dental Infection Control Guidelines that came out in 2003. There's a disinfection and sterilization guideline that the CDC has published. And especially for those practices that may be going through some accreditation process or really want to strive for that gold standard, Amy ST79 is going to outline everything that you should do in the sterilization area, but it takes time. It takes time, and time is money. And we've got to see X amount of patients because insurance reimbursement is not what it used to be. And all of those are really
Very
important.
valid.
They're,
Yes.
they're very valid. And I don't want to take away from that, but at some point people, we have to do what's right for our patients. That's why we went into healthcare, not to have them leave with something they didn't come with. And I'm not talking about a crown. So it's just getting the word out and assuring people that this is not a whim. This is important stuff. You are dealing with people's health every day. And I know that there's this separation between overall body health and oral health. And I hate that is actually in place. But I do think that hopefully we're moving forward where there's an integration. But what happens in the mouth can impact the entire body. And that includes infections. So you want to prevent that healthcare acquired infection if at all possible. So it's really, I think, uh, an important message for people to hear that it's not just about the oral health. There's a person sitting in that chair and you want to do the best that you can for them. That's and I do think that's where people's hearts are. I really do believe that, or I wouldn't keep, for lack of a better word, fighting the battle. Because sometimes it
And
is.
I know it is a battle, and I think that's why they're listening to this podcast right now. And so I really do thank you so much for your time. It's always such a lovely time to spend with you and just soak up. I joked in Italy. I hope I got a lot of it from osmosis from you, like just being near you, soak it up. So I appreciate you. I would love for you to tell everyone how to find you, learn from you, follow you, all of that.
Oh, thank you. I have a website, KarenGregoryConsulting.com. I have an Instagram account, Safety Stuff That Matters. And those are, Instagram is the one that I use the most. So those would be great ways if you want to get in touch with me. My email address is Karen@KarenGregoryConsulting.com. And thank you so much. I learned so much from you in Italy as well. And P.S., she's helping me with some of my social media because it is not my strong suit. So I really appreciate her pouring into me that way as well. Thank you for having me. It was a great joy to talk about sterilizers.
Thank you, and I hope everybody reaches out and follows her on social, and I hope you all enjoyed the message in this podcast today. Thank you for listening to season 3 of the Level Up Infection Prevention podcast. Don't forget to follow or connect with the guest, and while you're at it, follow me on Instagram, Level Up Infection Prevention, and check out levelupip.com for more details on all the digital courses and the Infection Control Coordinator's Guidebook.